Hello, welcome to Dental Notes and Mnemonics. Today we are going to talk about a group of the viruses that infect nearly everyone, often lie dormant for years and can cause a wide variety of diseases, the herpes viruses. The Herpesviridae family consists of large double-stranded DNA viruses. So let's talk about the structure of herpes viruses in a very simple way. Imagine a virus like four-layered ball. Each layer has a special role. At the center, we have the DNA core. This is where the virus keeps its genetic instructions. It is made up of double-stranded DNA, just like the blueprint of the virus. Surrounding the DNA is a protective shell called the capsid. This is like a hard armor made up of protein, giving the virus its shape and protecting the DNA inside. Outside the capsid is a softer layer called the tegument. This area is filled with proteins that helps the virus take over the host cell's machinery once it enters. And finally, on the outside we have an envelope, a fatty membrane borrowed from host cell. It is covered with the spike-like proteins called glycoprotein, which the virus uses to attach or enter the new cells. To remember these all four layers quickly and easily, just think of a phrase: don't come too early. D stands for the DNA, C stands for the capsid, T stands for the tegument, and E stands for the envelope. The Herpesviridae family includes 8 types of herpes viruses that infect humans, each designated as a human herpes virus 1 through 8. These viruses are classified into 3 subfamilies further based on their biological behavior: alpha herpes virinae, beta herpes virinae, and gamma herpes virinae. Alpha herpes virinae includes HSV-1 and 2, which causes oral and genital herpes, and Varicella-Zoster herpes, which is responsible for chickenpox and shingles. These viruses replicate quickly and establish latency in sensory ganglion. Beta herpes viruses include Cytomegalovirus, which is HHV-5, HHV-6 and 7, which have slow replication, cause latent infection in lymphocytes and other cells, and are associated with congenital infection, Roseola, infantum, and febrile seizures. Gamma herpes viruses includes Epstein-Barr virus, which is also known as HHV-4, and Kaposi sarcoma associated herpes virus. The grouping is based on the 3 main factors. The first one is which cells they infect or cell tropism, how fast they replicate and grow, and where they are hidden, that means they get latent in the body. First of all, we talk about the cell tropism, which cell they like to infect. Alpha herpes viruses infect skin, mouth, and nerve cells. Beta herpes viruses infect glands, blood cells, and kidneys, while gamma herpes viruses mainly infect B cell, which is a type of white blood cell. Now, looking at the replication speed of viruses, alpha viruses grow very fast, causing quick and often painful symptoms. Beta viruses grow slowly and infections can last a long time quietly. Gamma viruses grow in a restricted or slow way and sometimes are linked to cancers as well. Finally, looking at the latency, where the virus hides after the infection. Alpha viruses stay hidden in nerve ganglia like trigeminal or sacral nerves. Beta viruses hide in glands, kidneys, and some white blood cells, while gamma viruses stay in B lymphocytes and may reactivate later, especially in weak immunity. So let's discuss the multiplication or replication of herpes viruses briefly. They multiply by first attaching to the host cell using glycoproteins on their envelope. They enter the cells by fusing with the membrane and deliver their DNA into the nucleus. Inside the nucleus, the viral DNA is copied and the instructions through mRNA are sent to the cytoplasm to make viral proteins. These proteins and the new viral DNA come together to form new viruses. The assembled viruses gain an envelope as they pass through the cell's membrane and are then released to infect other cells. These processes allows the virus to spread or stay hidden or latent for later reactivation. Herpes virus enter a latent phase after initial infection where the virus hides in specific cell without replicating. HSV-1 hides in the trigeminal ganglion while HSV-2 prefer the sacral ganglion. Varicella-Zoster virus becomes latent in dorsal root and cranial nerve ganglion. Epstein-Barr virus remains in B lymphocytes, and Cytomegalovirus persists in monocytes and myeloid precursors. Both HHV-6 and 7 establish latency in CD4 plus T cells, whereas HHV-8 or Kaposi sarcoma associated herpes virus resides in B cells and endothelial cells. Now we will go through each group one by one. Reinfection of HSV-1 often occurs in childhood and may present as acute herpetic gingivostomatitis. Primary herpetic gingivostomatitis is mostly seen in children under 5 years of age. The disease patient presents with the multiple painful ulcers in the mouth, blisters that burst to form ulcers, fever, irritability, and swollen gums. Sometimes even skin lesions around the mouth may be present. This condition is self-limited, meaning it means heals naturally in around 2 weeks, but can be very uncomfortable for the child. After healing, the virus becomes latent, hiding in trigeminal ganglion. One may also be present as herpetic pharyngotonsillitis, especially in the young adults. After the primary infection, upon reactivation, herpes simplex virus 1 causes secondary or recurrent infections. Most commonly is the herpes labialis or cold sores. Sores usually present along the lip margin or vermilion border. The episode begins with a prodrome where the patient feels tingling, burning, itching at the same time about 24 hours before the lesion appears. This is followed by a vesicular stage where small fluid blisters form. These then rupture, leading to ulceration, and finally form yellow crust during healing, which usually completes in 7 to 10 days. The infection is most contagious during vesicular stage as the blister fluid contain active viruses. It can spread through kissing, shared items, or auto-inoculation by touching the lesion or other body part. Common lesions include lip, nose, chin, and sometimes a gingiva or hard palate may be involved. Sores caused by HSV-1 are usually self-limiting and heal within 7 to 10 days. Supportive care includes maintaining hydration, avoiding acidic or spicy food, and applying cold compresses to reduce discomfort. Topical antiviral creams like acyclovir or penciclovir are most effective if started during the prodromal stage only. For frequent or severe outbreaks, oral antivirals such as acyclovir, famciclovir, or vela-acyclovir can be prescribed. Good hygiene and avoiding close contact during active phase helps to prevent the spread of virus. HSV infection of finger, often seen in the healthcare or the dental workers, is due to contact with infective saliva, and it's very painful condition. Hepatic keratitis is when the virus infects the eyes, especially the cornea. It can cause eye redness, pain, and even blindness if it is left untreated. Herpes encephalitis is a very serious condition. The virus infects the brain, usually the temporal lobe, leading to fever, seizures, confusion, and coma. It needs urgent antiviral treatment. Herpes gladiatorum is also another clinical form of HSV infection. It spreads by contact sports like wrestling. Immunocompromised patients, HSV infection can be more severe, prolonged, and potentially life-threatening compared to immunocompetent individuals. Secondary infections are milder and they are triggered by stress and illness when we compare it with the primary herpes simplex virus infections. Classic histological features of HSV-1 infection is ballooning degeneration, multinucleated giant cells, acantholysis in epithelial cells. Diagnosis is primarily clinical, supported by tests like Zhang smear, which reveals giant cells, though it is not virus specific. Polymerase chain reaction is most sensitive method for detecting viral DNA, especially in severe or those infections involving the central nervous systems. Other tools include viral culture, direct fluorescent antibody test, and serology to confirm the past exposure. HSV-2 mainly causes genital herpes, which appears as painful blisters or sore around the genital and anal areas. It spreads through sexual contact and can stay in the body for life, causing repeated outbreaks. In newborns, HSV-2 may also cause neonatal herpes, a serious condition passed from mother to baby during childbirth. It can also lead to herpes meningitis, especially in women. After the initial episode, HSV-2 becomes latent in sacral nerve ganglia, staying dormant in the body. It can reactivate later, especially during stress, illness, and low immunity, leading to recurrent outbreaks. HV3 or Varicella-Zoster Virus causes two related diseases, chickenpox and shingles. Chickenpox is primary infection mostly seen in children. It spreads through air on contact with the fluid from the blisters and causes fever and a widespread itchy rash with vesicles in different stages. After the infection clears, the virus becomes latent in nerve ganglia. Years later, especially in older or individuals with weak immunity, it can reactivate as shingles, which is also known as herpes zoster. Unlike chickenpox, shingles affect only one side of the body following a specific nerve path or dermatome and causes burning pain and grouped vesicles. Complications caused by shingles include nerve pain that lasts even after the rash heals, called post-herpetic neuralgia. Ramsay-Hunt syndrome is also associated with herpes zoster when the virus affects the face, causing facial weakness and blisters near the ear, and eye problems due to ophthalmic zoster that can affect vision. Vaccines are available, one for children to prevent the chickenpox and the other for adults over 50 to shingles and its complications. Epstein-Barr Virus is HHV-4 and belongs to gamma herpesvirinae subfamily. It mainly spreads through saliva, earning its nickname kissing disease. EBV has strong attraction to B lymphocytes and can remain latent for life over there, reactivating in certain conditions. The most common illness it causes is infectious mononucleosis, usually in teens and young adults, with symptoms like fever, tiredness, sore throat, swollen neck, glands, and enlarged spleen. A skin rash may occur after taking ampicillin. Oral signs include red, inflamed throat with white patches on the tonsils and palatal petechia. And in some cases, gingival bleeding or nug-like symptoms may appear. In HIV patient, EBV may cause oral hairy leukoplakia, which is a white non-scrapable patch on the side of the tongue. EBV is also linked to cancers like Burkitt's lymphoma, Hodgkin's lymphoma, and nasopharyngeal carcinoma, and also to post-transplant lymphoproliferative disorders. Monospore test is quick and commonly used blood test which can be used to diagnose Epstein-Barr virus infection, especially infectious mononucleosis. It checks for heterophile antibodies, which are unusual antibodies produced by the body during EBV infection that can react with red blood cells from animals. This helps in detecting the infection. The heterophile bodies are recognized by a monospot test using a horse or cow red blood cells, and it gives a result in just few minutes. The Paul Bunnell test is an older method that also detects heterophile antibodies, but it uses sheep red blood cells and it takes a longer time. Both the tests work on the same principle. Cytomegalovirus is HHV-5 from beta Herpes virinae subfamily. This virus mostly remains silent in healthy people but can cause retinitis, colitis, or birth defects in immunocompromised individuals and newborns with infections. Orally, it shows a deep painful ulcers. It spreads through saliva, urine, semen, breast milk, and blood. The name cytomegalovirus is given to it because it means the large cell virus. Cyto means cell and megalo means large. Due to the enlarged infected cells with classic owl-eye nuclei, these viruses are named cytomegaloviruses. 6 and 7, both they belong to beta herpes virinae subfamily and primarily infect CD4 cells. HHV-6 is the main cause of Roseola infantum, also known as sixth disease, which typically affects infants between 6 months to 2 years of age. It begins with sudden high fever lasting 3 to 5 days, followed by pink rash that starts on trunk and spreads to face and limbs once the fever subsides. HHV-7 infects children slightly later, usually 1 to 5 years of age, and can also cause similar but milder Roseola-like illness. Both the viruses spread through saliva and remain latent in T cells. HHV-6 can reactivate, especially in immunocompromised individuals, while HHV-7 reactivation is less common. Coming to the last virus of herpes family, HHV-8. It is also known as Kaposi sarcoma associated herpes virus. Primarily, it affects endothelial and B cells. It is most known for causing Kaposi sarcoma, which is a vascular tumor often seen in immunocompromised patients, especially those with HIV or AIDS. Oral involvement is common in AIDS related Kaposi sarcoma, appearing as reddish purple patches or nodule on hard palate, gums, or tongue. HHV-8 is also linked to primary effusion lymphoma and multicentric Castleman disease. It is a rare lymphoproliferative disorder, meaning it involves abnormal growth of lymph node tissues that can affect multiple groups of lymph nodes and organs. Herpes stay in the body for life after the first infection, so complete cure is not possible, but the infection can be controlled. Prevention include personal hygiene, avoiding contact with active sores, safe sexual practices, and vaccines for chickenpox or shingles. Treatment mainly causes antiviral drugs like acyclovir, valacyclovir, or ganciclovir to reduce the symptoms, shorten the illness, and prevent reactivation. In patients with weak immunity, long-term antiviral therapy may be needed sometimes. So that was all about human herpes viruses from HHV-1 to HHV-8. Like, share, and subscribe for more easy videos like this. Thanks for watching. See you in the next video. Till then, bye bye. Take care. Have a nice day.